All right. Welcome everyone to It's Worth a Shot, something in the air for today. Good afternoon and good morning, wherever you guys are. We are so happy that you guys are joining us, and we appreciate your continued support for the It's Worth a Shot. Let's go ahead and go to the next slide. Just a quick reminder about our disclaimer. This presentation may contain information and/or content supplied by third parties. The information provided does not constitute endorsement or recommendation by Mountain Pacific. So just a quick disclaimer. Let's go ahead and go to the next slide. And some updates and reminders. We do have our educational series going on right now, so we want you guys to hop on that one as well. We will have the link in the slides, but this one is covering the medication for opioid use disorder. So this will be every month all the way through July of 2024. So a great opportunity to make sure you guys join us for that. And then let's go ahead and go to the next slide. And we want to show you guys, this is a new kind of campaign flyer that you guys will have access to here soon. It says, "Don't leave yourself unprotected this fall, get vaccinated." This is something you guys can distribute in your settings, and it has a QR code to the most current adult vaccine schedules. So good resource for you guys, and we will send that out when we send out our slides for next time. So let's go ahead and go to the next slide. And just a reminder, we will have an evaluation that we plug in the chat. We appreciate all of you guys' topic ideas. That's where we get all of these great topics and presenters. So make sure you guys keep sharing with us. We appreciate your feedback, and we take a look at that each time. So we have a quick polling question. So when is your facility starting resident, patient, and staff flu vaccine clinics? See how you guys are doing. Oh, some of you guys are doing clinics now, already done. You guys are on top of it. Good work. Started yesterday. Nice. You guys are on top of it. Good job. Okay, let's go ahead and end the poll. So it looks like if you're not already doing it, you guys are getting close to doing it, and we'll have it done by the end of October. There's just looks like one of you guys that don't have anything planned at this time. So let's go ahead and go to the next slide. And just our COVID updates. As you can see, our test positivity and emergency department visits have made a decline, which is phenomenal. Look at that, 19.3% decline. The hospitalization for the severity and the deaths, the hospitalizations is just kind of still tapering off. There's a small decline there, and the deaths, unfortunately, are still on the rise. But it'll be good as we start our next round of vaccines. Let's go ahead and go to the next slide. And you guys can see that over our areas for Hawaii, Alaska, Montana, and Wyoming, it's pretty mixed between the orange, the substantial increase, stable, and there are some areas that have actually had a decrease. So just to give you guys that visual, it is nice to see some yellow areas where areas are starting to kind of taper off. So, all right, let's go to the next slide. And I would like to welcome Jennifer Chakoyak and Valeria Delgado Lopez. They are joining us from Alaska, the American Lung Association. Welcome, both of you guys, and I will turn the time over to you.
Awesome. Thank you so much, Callie. I will go ahead and get started with the presentation. I will go over some information and resources that the American Lung Association provides. talk a little bit about tobacco, and then Jen is going to close us off talking about cessation. So like Hallie mentioned, my name is Valeria Delgado Lopez. I'm the Health Promotion Manager at the American Lung Association. And most of my work, the work that I do is in Anchorage, but also do some work statewide as well. Jen, do you want to do a quick introduction?
Yep, happy to. Good afternoon and good morning, everyone. I'm Jen Chikoyak. I'm a senior manager in health promotion with the American Lung Association, and I work statewide. I also do some work in California, and my main focus is around tobacco. I also get to I get to work around lung cancer screening as well, and yeah, as Valeria mentioned, I will come in a little bit.
Awesome. All right, Callie, you could change it to the next slide. That would be great. Awesome. So for over 150 years, the American Lung Association has led the fight for healthy lungs and healthy air. We are America's oldest voluntary health organization, founded in 1904 to fight tuberculosis, which at the time was the most dreaded disease of the time. Over the years, we've expanded our fight, targeting other threats to lung health. We were amongst the first to tackle smoking as the nation's leading preventable health risk and to make the connection between air pollution and lung disease. Today, we are funding research that unlocks the secrets of lung disease. From asthma to lung cancer, our educational programs help patients take control of the illness. Our network of regional offices across the country work with thousands of volunteers at the community level to fight for healthy lungs and healthy air right where they live. In addition, we provide vital research support. The Lung Association facilitates asthma care partnerships and provides training tools, as well as other resources to educate school personnel, healthcare providers, and families to improve asthma care for children. The association has been a leader in improving asthma management in school for close to 30 years. Next slide. The Lung Association is the leading organization in working to save lives. We work to improve lung health and, like I mentioned, prevent lung disease through education, research, and advocacy. Our focus is on 5 strategic imperatives: to defeat lung cancer, champion clean air for all, improve the quality of life for those with lung disease and their families, and create a tobacco-free future, and accelerate funding and organizational effectiveness to support our mission. And as you can see, we still have a lot to get done, since there is still an urgent need for lung health prevention. We know that lung cancer is the #1 cancer killer of men and women in the United States. Tobacco use is the leading preventable cause of death in the US. More than 4 in 10 people live where pollution levels are dangerous. Children ages 5 to 17 miss 7.9 million days of school due to asthma. And chronic obstructive pulmonary disease is the 3rd leading cause of disease-related deaths. And as we all know from COVID-19, there are epidemics that threaten our health. Next slide. Oh, I just talked about this. Yeah, so our this is just a bigger slide on our mission, vision, and the strategic imperatives that I mentioned earlier. Next slide. Awesome. So I want to talk a little bit more about some of our signature programs. One of our biggest programs that the Lung Association has is asthma programs. So we'll start off by talking about asthma basics. This is just a 1-hour interactive online learning module designed to help people learn more about asthma. So it's open to anybody who wants to learn a little bit more about asthma. Our other program is Asthma Education Institute. So this is more for healthcare professionals. This is a multi-day educational course for frontline healthcare professionals. So this is a great opportunity for anybody who's interested in taking a deeper look at asthma resources and education. Next slide. To continue on with our asthma programs, one of our adult self-management self-management programs is Breathe Well, Live Well. And this is for adults to learn about how to control their asthma, to live healthy and active lives. We also have Kicking Asthma and Open Airway for Schools. So both of these programs are youth focused, and they help youth learn about some of the warning signs of asthma, how to avoid triggers, and make decisions about their health. Kicking Asthma is geared for children ages 11 to 16, and Open Airway for Schools is for children ages 8 to 11. Next slide. So I want to continue talking about some of the other programs apart from asthma. One of the really great ones is called Better Breathers Network. So this is a community-based support group for people living with COPD and other chronic lung disease to improve the quality of life through education and support. This is usually sponsored by a community partner organization. It's often hosted in hospitals, health system, and it's led by a trained facilitator. So this is really a great opportunity for people who work in the healthcare industry. So if your facility is interested in hosting a Better Breathers Network, let me know. We also have some opportunities to get staff members trained to become facilitators for this Better Breather networks. The other great support that we have is the Lung Help Line. This is a toll-free resource providing education and support to callers on a full range of lung health topics. The individuals that answer those phones are usually registered nurses, respiratory therapists, pharmacists, and tobacco treatment specialists. And like I said, they can really help answer any lung health related question and provide that information as well. Next slide. Lastly, I want to highlight our patient and caregiver network. This is a brand new program that was launched in 2023, so this year. So this is a program that provides people living with lung disease and their caregivers with support, education, and access to research. So individuals will be able to connect with peers who are going through the same challenges. So it really is a great opportunity to build connection and access to really up-to-date information and research. Next slide. So moving on to our tobacco control history. So since we began our work with tobacco control, we assisted in prompting the first Surgeon General's report, have helped over 1 million individuals who smoke quit, have served as a major backer of smoke-free air loss, and continuously work to improve tobacco cessation coverage. Next slide. It is important to know that smoking is the leading cause of preventable disease and deaths in the US. Its use results in 480,000 premature deaths per year and costs the United States $300 billion in direct healthcare expenditures and lost productivity annually. Since 1964, 20 million deaths have been directly attributed to smoking. The users themselves are not the only ones impacted. Secondhand smoke is harmful to children and adults. There is no risk-free level exposure to secondhand smoke. And in 1964, 2.5 million lives, since 1964, 2.5 million lives have been lost due to secondhand smoke. It is estimated that about 58 million smokers were exposed to secondhand smoke in 2011 to 2012. This is why it's important for us to fight to keep and protect clean indoor air policies in our communities. Next slide. So I just wanted to highlight some of the short-term effects of tobacco use. As you can see, there's plenty. Shortness of breath, skin appearance pale and unhealthy, and one of the most the main factor, addiction to nicotine, which we are going to talk about in a little bit. Next slide. It is also important to know that tobacco use is a chronic illness and directly contributes to numerous chronic diseases. We know that more than 60 million Americans are living with a disease caused by smoking. We know that for every person who dies because of smoking, at least 30 people live with a serious smoking-related illness. Smoking causes cancer, heart disease, stroke, lung disease, diabetes, and COPD. Tobacco isn't a drug that kills users instantly. The tobacco industry's product causes chronic illness and disease, resulting in years of suffering. Next slide. So of course, since we're talking about tobacco, it is important to address nicotine dependency. The cycle of addiction is the reason individuals continue to smoke. Over time, with each cigarette, the individuals build a chemical dependency. Everyone that uses a tobacco product, they build a dependence on nicotine throughout the cycle of addiction. So basically, this is how it works. So after a person smoking takes their first puff of cigarette, nicotine is delivered to the brain in only 7 to 10 seconds. After that, the nicotine acts on certain receptors in the brain, releasing hormones and neurotransmitters, including dopamine, norepinephrine, and serotonin. After that, the person smoking feels that pleasure. It reduces tensions, appetite suppression, and enhances performance. After that, we see that nicotine accumulates in the body. Each additional cigarette creates a greater tolerance. The brain chemistry changes and tolerance is developed. Absence of nicotine causes withdrawal symptoms, and as the day goes on, the person who smokes needs more cigarettes to relieve those withdrawal symptoms. Overnight diffusion of nicotine throughout the body helps the person smoking regain his or her sensitivity to nicotine. And as you can probably see by the chart in the slides, the cycle repeats all over again. And the addiction to nicotine can happen immediately. We know that 1 in 10 youth who start smoking become addicted within a few days of their first puffs. Next slide. And while quitting earlier in life yields greater health benefits, quitting smoking is beneficial to the health at any age. Even people who have smoked for many years or have smoked heavily will benefit from quitting. Quitting smoking is the single best way to protect family members, coworkers, friends, and others from the health risks associated with breathing secondhand smoke. So in this slide, there are some important reasons to think about quitting. Next slide. So now I'm going to hand it to Jen, and she'll talk a little bit more about cessation.
Thanks, Valeria. This is actually a great place to pause to see if there's any questions, because this is a great graphic to look at as well. It is all the things that how your body can repair itself once you have stopped smoking or using tobacco products. So even within the first 20 minutes, your heart rate and blood pressure drop to normal levels. And as time goes on, you look at 1 month, your coughing and shortness of breath decreases. And at 10 years, your risk from dying from lung cancer is about half of a smoker's. So it's amazing how a body can repair itself. But all right, I'm not seeing any questions in the chat box, so I'm thinking it's probably safe to move on. Next slide, please. So Valeria had mentioned some of our signature programs, and the last one I'm going to talk about is our cessation program. We have Freedom from Smoking, which is a support group that comes together. And the American Lung Association, we've been a leader in the field of smoking cessation, and we're the only organization that offers users a full suite of quit options, including in-person and virtual delivery programs. Freedom from Smoking Plus which is our online virtual delivery platform where participants get to additional support as needed from the Lung Association's helpline. Solely our Lung helpline, which Valeria mentioned earlier, is a telephonic option and is also has a self-help guide that comes along with that. Quitting tobacco is not one size fits all. Individuals can choose the option that fits best for them. We can't make anybody change their behavior, participating in cessation services has to be voluntary. Freedom from smoking offers a systematic approach to quitting. There is a logical progression from awareness of smoking dependence to actual behavior change. We look at freedom from smoking as more of a progressive climb up the mountain with a backpack full of tools and resources, and not cold turkey quit attempts. Quit day occurs halfway through the program on session 4. And there's strong theoretical basis for freedom from smoking. It's an addiction-based model with behavioral health change focus. The program also supports the FDA nicotine replacement therapy medications. Next slide. So cessation, if for general public, looks different in every state, but 1-800-QUIT-NOW is the nation's quit line. It sorts people by their area code and then directs them to that specific state's programming. So it may look different, but the 1-800-QUIT-NOW is just the only number you need to know to get help. Next slide. So here, a few of our national resources. The National Cancer Institute has a variety of things that they can help. They have got instant messaging services available online. They've got a quit line call number as well, and then also a text servicing message. And then the CDC has their Tips from Former Smokers campaign. You guys may have seen some of the commercials on TV and in other various streaming platforms. And the Tips campaign is great because it's addressing health disparities. And so they bring in a variety of individuals that have had their lives change from tobacco use. And so it's great. You can plug into a particular population you're looking for to address. Next slide. Now I'm going to talk specifically about what's happening in Alaska and our Alaska Tobacco Quit line. We have some tailored programs that I'll go over, and then I'll also share some of the data from how we're serving people here, and then share one of the specific enhanced services that we offer. Next slide. So the Alaska Tobacco Quit Line is an evidence-based cessation treatment service, all forms of tobacco and nicotine addiction. So that includes like Zyn pouches, which are a new product that people are a little confused by. But anything that contains nicotine, the Quit Line can help address. Their Quit coaches cater the plans to the participant needs and are available 24/7. We have 2 enhanced program services, behavioral health, which I'll share a little bit more about in a minute, and then also a service for postpartum women. And then finally, there's an evaluation component to the Quit Line. Any HIPAA compliant organization can receive information on their patients. Next slide. The Quit Line offers free nicotine replacement therapy. So these are all the FDA, or not all, some of the FDA approved medications. There's no income or insurance restrictions. Participants can get 2 weeks of combination therapy, which is patches and gum, and then get 12 weeks of combined therapy, patches and gum, and that is for the enhanced services related to behavioral health. Now, of course, little asterisk, if any individual that you're working with has had a heart attack, a stroke, or any other medical conditions, we really encourage them to start that conversation, the quick conversation with their provider before starting NRT. Next slide. So in fiscal year 22, which was just a couple of years ago, the Alaska Tobacco Quit Line received about 1,800 calls. The majority of those participants enrolled over the phone, so like 65% of folks came in via the phone. Provider referrals came in at about 16%. And what's interesting about provider referrals is that providers have the biggest impact on motivating an individual towards thinking about quitting, which is why it's so important for a provider to ask about tobacco use at every visit. and then advise them to quit and to refer them to services. Next slide, please. So I just wanted to highlight a little bit about the behavioral health program. This is a particular area of one of my passion projects, I guess you could say. 1 in 4 people in the US report having a mental illness and or substance use disorder. The behavioral health population consumes 40% of all the cigarettes sold in the US and smoke more daily and down to the filter. They have 2 to 3 times higher smoking prevalence than the general population. So that's just crazy to me. As a consequence of this, the behavioral health population dies 5 years earlier on average than the general population. Next slide. So because of the impact, the great amount of use that we're seeing amongst the behavioral health population, the Alaska Tobacco Quit Line has created a special protocol for these individuals. This enhanced program offers tobacco users an additional services, which include a longer supply of nicotine replacement therapy, the 12 weeks of which I mentioned earlier, and additional support calls. And then also individuals have access to the mobile app and to web coaching and a quit guide. And it really is to kind of help create that full wraparound services for individuals to help them quit. Next slide, please. So let's chat for just a second about smoke-free spaces. Some of you may have clients or patients living in multi-unit housing and that may be exposed to secondhand smoke. We believe everyone deserves to live, work, study, and play in smoke-free environments. By implementing laws and policies to make our community smoke-free, we can protect all workers and patrons from the dangers of secondhand smoke, reduce disease and death associated with secondhand smoke, and motivate smokers to quit. And finally, reduce the number of people who start smoking. Next slide. So we have 3 signature reports each year. In January, we released the State of Tobacco Control, and this is a grade for how our tobacco control programs are doing and how policies related to smoke-free air and tobacco taxes and tobacco 21 laws are. And then we also receive a grade of federal government on FDA regulations of tobacco products. In April, we released the State of the Air report, which grades city and counties on air quality. This report has the largest media reach of our 3 signature reports. And then lastly, this is the one that this will be like a little teaser for what's to come soon. The State of Lung Cancer report, which is released in November. This shows the impact of lung cancer and how survival rates vary state by state. I think Alaska is like 6%. It's ridiculously low. And we're working to make that better. So we've been asked to come back in November and talk a little bit about lung cancer, and we're going to be so delighted to do that and hope that you all will join us as well. Next slide. And that's the end. This is how to get a hold of us. If there's anything that we mentioned during our presentation today that you're like, yes, I want more information about that, or yes, I have somebody in my facility that would love to be a Better Breathers Club facilitator, please reach out. If there's any needs that you have, we are here to help. And thank you so much for having us today.
Thank you, Jennifer. Mary, we can go to the next slide. I just want to thank both Jennifer and Valeria for coming on and speaking with us about this. I know that sometimes in our line of work right now, it just kind of seems like the last thing that we want to deal with at this point in time, especially with patients in Medicare facilities and, you know, having been longtime smokers or whatever, that it just seems like one more thing that we're trying to take away from their happiness. But that's really not the case. What we're trying to do is really improve the quality of life. So again, really want to thank you guys for coming on and speaking. Does anybody have any questions they'd like to ask? They want to come off mute or put in chat. Does not sound like we have any at this point. Okay, can we go to the next slide, Mary? Again, I want to thank everybody for joining us today. There is a link to our evaluation. So if you guys can fill it out for us, we'd really appreciate it. And as Jennifer mentioned, they will be coming back to join us in November to talk about lung cancer screening. So that will be great to hear. And then if you want to join us next week, we're actually going to be having a presentation by Mountain Pacific, and it will be concerning the team that's kind of opposite of our nursing home team. Help me out, guys. What's the PCH stand for again? I know I just learned this.
It's Partnership for Community Health, Miranda.
Thank you. I always want to say patient-centered healthcare, and so then I can't think of anything else. But anyways,
so it's essentially the coalitions that we participated in our region. So we're just going to be providing more information on what those groups look like and what their initiatives are.
Great. Thank you, Kyla. Really appreciate that. So again, we want to thank everybody for joining us today and hope you guys have a great Wednesday, and we'll see you all next week. Same time, same place.